I'm outside the Royal Society of Medicine. We've had a full day of talks on TalkNHS. We've had the opportunity to speak to Richard Murphy on the neoliberal agenda and taxation, and we'll bring you that later on. And we're about to show you some clips from Professor Stephen Hawking. Please keep sharing, follow us on Twitter, and help us spread the word.
Can you hear me? Yes! I would like to thank Discourse for inviting me here today, and the Royal Society of Medicine for hosting this important meeting on the National Health Service and its future. Like many people, I have both a personal experience of the NHS and an interest in it that goes beyond the personal and is core to our view of a civilized society. In 2009, I went to the United States to receive the Presidential Medal of Freedom from President Barack Obama. At the time of my visit, President Obama was campaigning for the Affordable Care Act in the face of intense political opposition. While it is not the sort of free, publicly funded and provided care we have in Britain, the Affordable Care Act means that insurance companies must offer an option of a basic level of health insurance, with lower premiums than before. At the time of my visit, an editorial was published in the U.S. financial newspaper, Investor's Business Daily. The editorial stated, people such as scientist Stephen Hawking wouldn't have a chance in the UK, where the National Health Service would save the life of this brilliant man. Unfortunately for Investor's Business Daily, I got to hear about this. I refuted their claims, saying that not only am I British and very much alive, but in fact wouldn't be here today if it were not for the NHS. We see that the direction in the UK is towards a US-style insurance system run by the private companies, and that is because the balance of power right now is with the private companies. On the other hand, there is the force of the public and of democracy. Opinion polls consistently show that the majority of the public agrees with me and is in favor of a publicly provided NHS and opposes privatization and a two-tier system. So the public already supports the core principles of the NHS as the fairest system, and so what the public needs is the knowledge that this is also the most efficient and cost-effective system. As I understand, many here today are part of a growing movement to empower the public with exactly that knowledge as the NHS reaches its 70th birthday next year. Having spent a lot of time in hospital, I would like there to be more services available in hospitals at weekends. It has been frustrating for me personally when everything slows down at the weekend in hospital. Also, it seems possible that some patients spend more time in hospital than is necessary because certain diagnostic tests can only be done on weekdays. So in principle, a 7-day service could be of benefit to patients and to the NHS as a whole. However, any change like this must be properly researched. Its benefits over the current system must be argued for, and evidence for them presented, and the implementation properly planned, costed, and the necessary resources provided. There has been no proper due diligence done in the case of the so-called 7-day NHS, and that was the whole point of our letter, and the reason I signed it. Let me quote from the letter, as it illustrates a further point I want to make. We wrote, the evidence for these claims is not supported by reliable research. Of the 8 papers cited by Hunt, only 4 are peer-reviewed. 3 use data from the same population and are not independent, with just 2 from the last decade. The remainder are not peer-reviewed medical literature, and are only opinion pieces. Critically, when his claims began, at least 13 independent peer-reviewed papers were available to the Secretary of State that refute his definition of a weekend effect. Hunt has cherry-picked research. Speaking as a scientist, cherry-picking evidence is unacceptable. One consequence of this sort of behavior is that it leads ordinary people to not trust science, at a time when scientific research and progress are more important than ever, given the challenges we face as a human race. There are two ways to think about a national health care system. One is that the most humane and civilized system is one in which all people are provided for equally, based only on their needs, no matter who they are, rich or poor, young or old. I believe this, and have made public statements, that we must prevent the establishment of a two-tier system, with the best medicine for the wealthy, and an inferior service for the rest. The other way to think is that a health care system needs to be organized in the most efficient way, so that there is as little waste of labor and resources as possible. International comparisons indicate that the most efficient way to provide good health care is for services to be publicly funded and publicly run.